People, when they're considering having their hip or knee replaced, they always ask, well, how long am I going to be in the hospital? I remember my grandfather 30 years ago, he spent a week in the hospital. But I hear about this, same day program or outpatient joint replacement. That's the thing of the day. Well, the reason why we like to talk about going home the same day of your surgery, which is by definition what a same day discharge is because people who go home sooner typically do better. After having done joint replacements now in the United States as a community for close to 40 years, we've learned the faster that you go home and re-enter your life, once you're medically stable, on average, the better you're going to do. Because the whole purpose of the hospital is not to get better from your surgery, it's to be stable so that you can go home to get better from your surgery. It's basically 4 principles that you get discharged the day of surgery or 100 days after your surgery. It's the same. You have to be able to eat and drink. You have to be able to pee, so that way we know that all of your body systems are working. And probably most important, you have to get up and pass your physical therapy evaluation, which the culmination of that is being able to go up and down stairs. So if you can do all of those things and everything is stable, you're a great candidate to go home, whether that's the day of the surgery or 100 days after surgery. So what happens on the day of surgery? Well, quite simply, typically you have to get to surgery about 2 hours before your scheduled time. So for instance, if you're a 7:30 start on your day of your knee replacement, you have to typically get to the hospital or the surgery center around 5:30 in the morning. Why? Well, there's a lot of work that goes in to get you ready to have your knee replaced. So you have to meet the nursing staff. You have to get your clothes taken off, put in the bin, get the IV started. They do a series of soaps and scrubs to try to minimize the amount of bacteria on your skin. You meet the anesthesia provider that's going to be helping you, not remember that part of your life. And now we're actually ready to bring you to the operating room. Surgery for a hip or a knee replacement, depending on how severe your arthritis or deformity may be, can last anywhere from 30 minutes to 2 hours. So you have that procedure done. You wake up from surgery in the recovery room, you're going to be feeling groggy, maybe tired. And now, if you had surgery at 7:30, let's say it took an hour, you come out of surgery at 8:30. So now you're waking up in the recovery room. Typically takes about an hour and a half to 2 hours or so before you're feeling a little bit better, you're talking, you're awake. And then we're going to start talking about, let's think about walking. So first thing you have to do is drink something. Make sure that you're not too nauseated. Then you do that, maybe eat a little bit of Jell-O, sit up at the side of the bed. If all that's going well, then the next step is maybe take a stand. And if that's going well, then we can try to call in our physical therapist and you actually get to have your physical therapy evaluation. On average, that's usually on a same day discharge for a knee replacement or a hip replacement, somewhere between 4 or 6 hours after you're leaving the operating room. And if that all goes well, you're at home, early afternoon, maybe late evening, and having dinner in your own living room. Another question people often ask is, well, what's going to happen with my pain after surgery, and especially when I'm having to do the physical therapy for the next few weeks after I have my hip or knee replaced? Well, to start with, if you're having a knee replacement, the nice thing is with modern anesthesia techniques, they can do something that's called a block. So you can have an injection performed in the mid portion of your thigh. This is usually done right before surgery or right after surgery. That can give you some numbness down the front part or anterior aspect of your knee. So that's the first thing we try to do is let's try to numb the pain out for a little while. So what we typically do is we start everyone out on the maximum dose that they can tolerate of Tylenol, the maximum amount of dose they can take of, an anti-inflammatory of their choice, and then we supplement those with narcotics. And we usually say try to wean off the narcotic medications as soon as you can while still being able to perform your physical therapy. So an important part of having your joint replacement while using pain medications is, yes, we want to get you off them, but don't get off them too quickly to where now you're in so much pain that you can't do the therapy that's necessary to get a good outcome. And don't forget how important it is to walk. I have my patients walk on an hourly basis after they have their hip or knee replacement done. Walking is really good for pain management, helps to relax those spasming muscles after they've had some trauma from surgery. So how do we control pain? And the long answer short, well, we use medications, both injections and by mouth, but most importantly is movement. All that can help minimize your pain and try to get you the best outcome after having your hip or knee replaced.